the bands that I have, and you don't even have to get it. You can actually just use like gravity, but I brought my stuff just to kind of show you. And you don't need, you know, the gym necessarily. But I think that the best way to go about it is doing a little bit of information right at the beginning and then just going right into exercise. And it's okay if you're not in like exercise clothing. All of this stuff is relatively easy and it's more review. And getting you to learn what it's called and then being able to go home and reading it and say, okay, yeah, I remember what we did, and then executing. Is anybody nervous? Okay. That's the big thing. I think that obviously with what you guys are doing for yourselves and lifestyle changes, you're learning a lot more about your body. And I just think it's really important to know that you shouldn't be afraid to move. We're designed for movement. I think you've probably heard the term, sitting is the new smoking. It's horrible for us. It's absolutely horrible for us to sit. I'm sure a lot of you work at a job where you do sit. And so exercise kind of provides this escape for your body where you can give it the benefit it needs. Stressing your muscles, stressing your bones. And there's a lot of benefits, you know, for longevity of your life and things like that. So, do any of you currently follow an exercise program?
I just walk.
You walk. Okay, that's good. Anyone else? Okay.
I just work all day.
You work? Are you down in a seat or are you up moving?
I walk all day.
Yeah, so that's good.
Pallets and stuff like
So you're putting a ton of steps on that way. That's great. That's great. So exercise has a ton of benefits for us. Weight loss is usually the one that people think of right off the bat. We're like, okay, if I exercise, I'm going to lose weight. And yes, that is a benefit. Weight loss obviously is a lot of different attacks, so you can go about it like you guys work with that with the Roy. It's a lot of nutrition, right? And even maybe just increasing your water intake or something like that. So what I like to really promote about exercise that I think is put on the back burner is it has huge effects on stress and anxiety. And if any of you suffer from stress or anxiety, which I'm assuming it's almost everybody, I mean, we all kind of struggle with that. It's amazing when you do bring exercise into your life, that real relationship you can create with it. And it really does have all these effects like lowering your heart rate, lowering your blood pressure, all of these things, but it changes the neurochemistry in your brain. And in like a really simple way to put it, it can make you happier. Sounds silly to say it that way, but I'm sure you've all heard that, right? So what I always write down as the magic number is 150 minutes of exercise a week. And I know that that sounds incredibly overwhelming right off the bat, but a bunch of organizations, academies, whatever, the kind of the main leaders in exercise in our country say that 150 minutes per week is what's recommended. So what does that mean? We have grouped walking into that, hiking, cycling, swimming, circuit training, which is what I'm going to show you today, and then lifting, of course. Working at a job where you lift pellets and you're walking around, that does count. But if you're doing it for 8 hours on end every single day, you almost want to think about that as your, yeah, you try to up it, right? That's your normal leisurely day, and then you're going to go on top of that. 150 minutes a week. So if I'm working with a client one-on-one, I usually do 2 half-hour sessions a week. So I'll say, okay, you're getting 60 minutes with me. The rest is up to you. What are you going to do for it? And we make a plan. What I think for you guys is really effective is saying, all right, it's going to be 30 minutes every single day, 20 minutes this day, maybe you do 60 the next. Either way, Sunday to Sunday, you should have a mental clock of 150 minutes. For the couples in the room, I think that doing a calendar system for each other is really good, and anyone else can do a calendar too, but if you guys can say, like, hey, I need to hold you accountable for your 150 minutes, that's so, so, so good. And if you want to lose weight with maybe faster, I guess is the best way to say it, you would need to up that 150 minutes to 175 or 200 minutes a week. But I'm always really careful when I come at that with that information at people, because I think it gets overwhelming really quickly. And I've learned over the past few years working at Apex Personal Training, I work with a lot of older clients. I work with a lot of people who have had huge weight loss journeys, 60 to 100 pounds. And if you have all this information on day one, like, okay, I want you to get 200 minutes a week, it's too much. And normally you'll say, hey, exercise is not for me. And I can't tell you the amount of people that I've come across who say, I don't exercise because I had a bad experience with it. I don't exercise because it upsets me when I, fail, things like that. So I know that you guys set goals with Roy. You guys do that. I think that goal setting is so effective, but you have to be careful. So I'm giving you these numbers today. Maybe next week you say, okay, I'm gonna get 75 minutes of exercise this week because that's what I can control and that's what I feel like I can handle. And then we move up from there. Do you guys feel that you are capable of doing 150 minutes a week and it's just kind of life gets in the way sometimes? Yeah. So the best way that I suggest starting is walking. And walking is so great, especially with our weather right now. If you can knock out a walk every morning, it's so cool. It feels great. There's an amazing trail system in Billings I think a lot of people don't know about. Is everyone from Billings?
I just moved here a couple months ago.
Okay. All right. So if you live somewhere else, I'm sure that you can go outside safely. We do live in Montana, but like Zimmerman Trail up on the rims is absolutely incredible. Norm's Island is really fun. You can wrap around in Swords Park to the Heights. I mean, there's amazing trail systems here. So the first thing I say is get out and walk. And it's amazing what walking can do for us. Cycling is another option. Cycling is tough outside, weather dependent, but you could do stationary cycling, and then swimming if you have access to a pool. So all those things I listed are categorized in aerobic training. And then what I'm here today to show you is some anaerobic training or lifting or circuit training. And it's where we actually stress the muscles, do things that create tone, create hypertrophy, your muscles start to grow. And that's grouped into the anaerobic category. And what I want you to think about in your 150 minutes a week is anaerobic and aerobic. So that doesn't mean you have to walk every day and lift. If you want to walk on Monday, lift on Tuesday, walk on Wednesday, you just need to count those minutes down. Yes?
What do you categorize yoga and Pilates as?
Pilates is an awesome combination of anaerobic and aerobic. Yoga is super dynamic, and so I often won't really put it into either one of those categories, but I'll count it as your minutes because you're holding a lot of positions where anaerobically you are working, but your heart rate doesn't elevate as much as it would like if you were to go swimming or something. Right. However, it's so good for you. Okay. Do you do yoga here in town?
I'm just getting started with a book, so
yeah.
I've done it before, not here, and I've done Pilates, not here, but...
Okay, they're fantastic. And just that, movement. Anything that you can do to move is what I want you guys to do. So I know that what normally comes in the way is injury. At Apex, I've really created a clientele where I work with people who are significantly injured. So a lot of physical therapists in town will send me patients who have been discharged from physical therapy but are not ready to go off on their own. Whether it's replaced joints or car accidents or just kind of getting older and weaker. And so I want you to know that I have that empathy towards that. I know what it's like to be in pain when you're moving. I know what it's like to be so afraid to start an exercise regimen because you don't want the pain to be detrimental to you, and that's okay. I think that you just try to create this relationship with exercise in your mind that it will make you stronger to prevent injury and illness, along with your food. I mean, you guys, know that if you eat differently under what you're programmed here, just think of how great you feel afterwards. And that's kind of how exercise goes. 6 months into a program, you look back and you're like, dang, I feel really good. Any questions so far? Okay. So lifting benefits for you guys that I think are important to point out are balance. So as we get older, our balance just totally plummets, and there's not a lot you can do about it. It's our neurological system. It just stops synapsing as fast as it should. If you exercise, your balance will definitely deplete a lot slower, which is good. Balance is scary. I'm sure you all know people who have taken spills as even in their 50s that break hips, you know, ankle surgeries can come out of falls. And then we live in a place where we have ice to worry about. And so that just adds kind of another threat. Another lifting benefit is the decreased heart rate, decreased blood pressure, decreased stress and anxiety. And so I think that as you start doing this stuff, kind of get in tune with your body and say, what am I feeling now? And then in 6 weeks, okay, how do I feel now? And I think that you'll get to a point where you know that if you exercise for 20 minutes, you're gonna feel better. Improve sleep. So who here has a hard time sleeping? Sometimes. Yeah, and I know that that's one of your pillars of health here. If you do anaerobic and aerobic activity throughout your week, your sleeping improves. And obviously, people can argue all day with me about that if we're gonna throw in like caffeine and traumatic events and conditions. But on average, if you exercise, your sleep will improve. So that's all really good stuff. Then what I kind of get really passionate about is muscle imbalance. So most of the time, if you're not active, we develop these really horrible muscle imbalances. And you know, I could pull all you guys up here and start to assess you what's wrong in your body. And mostly, yeah. Who's first?
We'll turn the lights on. You have to pull us up there to find that out?
No, I could probably start picking at you, but that'd be mean. But so the biggest one that I notice is our chest, right? So we're all rolled forward here. All of our shoulders come forward because we live in a world where we're either on a computer, on a phone, we're sitting and reading, hopefully, you know, something that makes you smarter. I don't know. But your shoulders roll forward. And so what happens is your pec muscles get very tight and short, and your upper back muscles get very long and weak. And so when I try to pull you into position here and make you do exercises to hold you there, it's hard. And then when you're 85 years old and you're walking around like this, there's just like no hope for you because we start to sag, right? So that's the beginning. Women, really tight hips usually, coupled with weak glutes, and then really bad low back pain. Who has low back pain? All of you except you. 3. That's good. That's good. Women have really bad low back pain. So I work a ton on that, and I can show you some really good hacks to that today. And then the other one is usually our hips. So men tend to have really, really tight hips. I don't know if you guys have any tight hip pain. And then women have weak hips. So a lot of what I can do can kind of fight both of those things at the same time. But the big thing is we do these things and maybe you feel more comfortable walking around your house. Maybe you feel more comfortable walking around outside. Maybe you feel like, okay, I can play with the grandkids. I can walk and go play with my dog. I don't know, little things like that. I'm a functional movement trainer. You know, if you can pick something up and push it over your head that you didn't used to be able to, that's what makes me excited. I'm not about physique. I don't care if you want to, you know, look all shredded up. It's really not my style. So I think that you'll like what I have today. The way this is designed is you could do this entire circuit in one day. It might take you more time right now. Maybe it takes you 40 minutes. But when you get good at it, you can knock it out 20 minutes at home, or you could split it in half. And I don't expect you to do this every day. The best suggestion I could give you would be every other day. But I think what's easier to wrap your head around is Monday, Wednesday, Friday, or like Tuesday, Thursday, Saturday, 3 days a week. 3 days a week is plenty for this. And I've designed it so you can do it in the comfort of your own home, and you don't have to go into the gym. And I know that fitness centers can be a little bit intimidating, and also there are, places you can go where the fitness center makes you worse off. I know a lot of people who have gone to fitness centers, worked with trainers, gone to CrossFit, I don't know, the list goes on, and they end up getting hurt. And so if you're in your home, you feel comfortable, I know that you're not going to get hurt because we're going to go over all this today. We're good, right? Okay, so I'm going to pass out these sheets, and we're going to start to move through this. And I just want you to do what's comfortable for you. If you're not comfortable with something, don't do it. Just watch and maybe support your peers. And there's a couple of things on the floor. And for that, you'll have to lay on your back or on your stomach on the floor. If you don't want to get on the floor, I'm not going to make you. But I think when you're at home, maybe try it out, or try it in your bed if you have a nice firm bed. So, just pass these out. Now, if you guys want to make notes on this, that's totally fine. I tried to leave a little section on the right side.
Extra one I can give to my cousin who didn't make it.
Absolutely. I can give you as many copies as you'd like. There you go. Okay, so first motion, I won't go through a ton of repetitions because I don't want you guys to feel like you're overly fatigued and sweaty, and I know that some of you are in nice clothes, so that's totally fine. I just want you to at least try it, and I can say, hey, this is a little tweak on that. So the first one is a get up or a squat. So we all know what squats are. I'm sure you've seen people squat all the time. But instead of going straight into a squat, which is a super, super complex movement, I just say, let's do get-ups. So you can sit in your chair, and if you're at home, all you do for get-ups is hands out in front of you, and you just stand up. That's all you do. And it'd be over and over again in a series of repetitions. To make it harder, your hands can move from here to here, or you can hold weight. Every time I want you to sit back down, on the chair, and then stand up again. Let's just do a few. Feel comfortable with it. Take your shoes off if you want to. You don't have to do it. That's okay, yep. And hold your hands out. And when you hold your hands out, these muscles back here, try to squeeze your shoulder blades together. So what I always say is if there's a pencil on your spine, you want to pinch it there while you do the get-ups.
How much of a pinch? I mean, are we...
Like that. Yep, just like that. And that's right. And it'll get tired. And when you pinch, you don't want your shoulders to go up. So that's the other thing. So you would do 12. Feels kind of nice. If it feels easy to you, then you're ready to progress to a squat. So all a squat is removing the chair and doing it without the pause. The problem with squats is most people, their knees get all weird because we're kind of weak. So when you squat, your knees have to always stay behind your toes. And that's the rule, and that's what you can practice with get-ups. So the second your knees start to go out over your toes, yep, so you'll go butt back, squat here, and then up. So to squat, you'd come here, and you drop as low as you possibly can, so you never have these knees go over your toes. You can drop lower if you want, and then you just come out of it. So normally, that's good. What happens is your knees come forward first, so just say I'm going to dramatically stick my butt out. It hurts? Good. That's sweet, right? That's how you get a good butt. He's like, look at that. That's amazing. Wow.
Oh. That's not the problem, is when I go like this, I can't.
See, that's good. Good, and you just you give yourself that feedback, always watching the knees. A lot of people you'll meet have a pretty horrible relationships with squats because they have hurt their knee. And that's all you have to watch. It never goes over your toe, and it stays right over top of your foot. Your knees will be really happy. That's what they're supposed to do. That's kind of a movement they're designed for. What are you thinking over there?
Snap, crackle, pop.
Need some ice? It's popping. You need the ice?
Okay, good. So the next one is a little more advanced. So if you feel kind of unstable, let's not do it. But this is for the back of your thigh. So for every squat That's your quads and your butt. We have to combat it with the hamstrings in the back. So the easiest way to just think about it would be just reaching down and touching your toes and then standing up. But if you notice when I do that, my butt shifts backwards, my knees are slightly bent, and I hinge over my hip bone like this. My back is flat, and then I stand up. So you see people doing this in the gym with weight, right? They're called deadlifts. So that's a deadlift form. You can do these without weight. You could hold something at your house, like a cat or
Like 40-pound dog.
a 40-pound, just kidding. But I don't know, something you can make do. But what you can do to make it harder is go onto one leg. So these are called a one-leg modified RDL. So this is where I just want you guys to be careful because of balance. You're going to tighten your abs. So you're going to suck your belly button to the back of your spine. Or for men, the best way to think about it is you're going to tuck your rib cage in. So we're going to tuck your rib cage, and all this is on now. And you're going to come onto this one leg, stand up. So my knee is slightly bent. This is advanced. I just want you guys to see. Yep. So this is kind of a stretch. My knee is slightly bent as I travel down like this. And then when I stand up, it snaps straight. It's kind of dramatic. And you'll feel these hamstring fibers turn on. Do you feel that? If you're nervous, turn around and do it off your chair. Like this. Just touch there. Yeah, snap it straight. It's one leg RDL. So if you're getting pain in your low back, that means that your abs aren't tight. So sometimes your abs have to get stronger before you can do this. Well, and I'll show you that once we get on the ground. But we just want to memorize that this core contraction is on all the time and never stops.
So is it typical that one leg may be easier than the other?
Yes. Usually your dominant side, your balance is going to be better. On your non-dominant, your ankle is going to be like, what's going on? And that's totally fine. Just start at like lower surfaces. If you have a coffee table, those work really well. So you do 12 each side. If you don't like it, like it's really effective to just do a 2-leg deadlift and stand out of it. And when you stand up, I'm going to thrust my hips forward and I'm going to straighten my knees. And I'm going to squeeze my butt cheeks at the end. Do you feel this muscle turn on when you do that?
Yeah. I don't know. Do it again.
It's like a shift like this, and then I'm going to thrust forward.
It's the bend and snap.
Bend and snap, baby. That's right. Okay, so that's on the top. That's get-ups, 1-leg RDLs modified, and 2-leg RDLs. Now, step-ups are in the middle. We don't have anything to do step-ups on here, but if you have steps in your house, step-ups are an amazing exercise. You have to be careful with step-ups. Let's see if I can show you off of this. So a 12-inch step works perfect, and what you would do is you'd stand in front of it and just go up, up, down, down, up, up, down, down, right leg 12 times, left leg 12 times. Those will get your heart rate up. Yeah.
Up,
Down, down, and then again on the right. Yep, just like that. So when you step up, this is really high, but you're gonna give yourself feedback here. Again, the knee does not go over the toe. It's bad for your knee. So you're gonna stay back here. Sorry that I'm putting my shoe on your chair. But when you stay back here and push off, you're gonna feel this deep muscle in your hamstrings load. If you go forward, you're gonna feel pain in your knee. Okay, so it's always loading backwards. Same thing when you come down, the knee stays behind the toe the whole time. What I'll do if I'm with you is I'll stick my hand here. So have maybe someone at home do it, or do it in front of like another chair or a wall, and don't let that knee sneak forward. It will, because our bodies love to cheat. They love it. They're naughty. Okay, so that's everything I have standing up. And then let's drop down on the ground if you're comfortable. If you don't want to get on the ground, that's fine. We're going to go on your back. This stuff is my favorite. So, you're like, yes. Okay, so your feet are actually perfect. So everyone kind of line your feet up in line with your hips. Good. Let's go a little wider here, just a little. Good, and then closer to you. Yep, perfect, perfect, perfect. Perfect. You just lay on your back and bend your knees. Yeah, good. So it's kind of comfortable, right? So I want you to kind of tune into what's going on with your low back area. And I'm guessing that your low back is arched off the ground. So what I want you to do is tilt your pelvis so that your spine has to flatten. the best way I can say it is thrust your hips forward and hold. So if I were to come in there and stick my hand in your low back, you'd be pushing into me. So like this. Yep. So I'm always like push into my hand. So do you feel those little spinal muscles trying to fire? Okay, so that's the first thing you have to get good at when you're doing this stuff. Sorry. Good. You don't want your back to arch. So, with that being said, now suck your belly button to your spine or tuck your rib cage in, so that just means abs on. Push into the ground, bridge your butt up, and lock your hips, lock your cheeks out. Good, and come back down. So bridge up, bridge it, bridge your butt up. Yep, come all the way up. Yeah, lift up. Oh, I'm so sorry. Okay, don't do it. Yep, so maybe even just like, if you push in,
do it a little bit at a time.
yeah, push in and just like squeeze the muscles and then, but don't come off the ground and just feel them fire because your glutes just need to activate. Good, so go up, down, up, down. That's actually perfect. Yep, and then, well, let's go again. Feel how high you can go. Like lock all the way out and squeeze these together. Good, and then go back down. So while you're doing that, your abs have to stay on, right? That's called a glute bridge. There's lots of ways you can do the glute bridge. You can just knock this out in reps. You could do 12 reps. You could do a glute bridge march, which I'll show you next. So now you're gonna bridge up and hold it. And now bring your right knee to your chest, set it down. Now your left. Yep. And bend your knee and bring it up to your chest. Yep, and you'd go back and forth, and you do that for 60 seconds. So get in tune with your body. Your abs cannot relax. If your back is hurting, it's because your abs are relaxed, right? And I get it, because your abs have to get stronger, you know?
What do your hands?
They're just flat by your side. You're like, what do I do with these things?
I hold my butt up with them.
She's like, I push. Okay, so now, just for the people that feel like you can do this, come down and stick one leg in the air and do a one leg glute bridge. Now, so just bridge up on the one that's touching and go back down. And you can do 12 of those and straighten this guy out. Yep. So that's the next advancement. Now, every time you're coming down, your back should be flattening it up against the ground. Your abs should be on the whole time. I want your abs tired. So, I know you get sick of me saying abs on. This is the biggest challenge when you're working out. So, I want you to practice with this exercise. Now, keep your knees bent, bring your feet together, and turn your abs on. And now, pulsate your knees away from each other and back in. Good, and keep doing that. Flatten your back against the ground, abs are on, knees are moving, and now I want you to register, are you breathing? Most of you probably aren't. So what we're doing right now is training the neurons in your brain. We're saying, hey, I need you to breathe, keep my abs tight, and move my legs. Your breathing muscles and your ab muscles are not the same thing. So we have to differentiate that. So this is this is actually a physical therapy exercise where you learn abs on. You guys feel that?
Yes.
They should start to fatigue. Good, and I'm kind of timing. Okay, so now, if you have room, you might have to just scoot this way a little bit. You're gonna straighten your arms out behind you and straighten your legs out. In this position, your back arches. So go ahead and tilt that pelvis so you're flat. Good, so I watch everyone's core turn on. Tilt the pelvis so the back is totally flat. Take your right arm and your left leg and come and meet them over your belly button. And go back down. Good. So, let's go all one side, count to 12. And again, go into that little back muscle and say, I'm flat against the ground. I'm flat against the ground the whole time. It never relaxes. Your head and shoulder can come up too. That'll get the abs activated. Good. So did you do this in PT? Or did you not go to PT? This is what they'd have you do for low back stuff. It's awesome. You guys feel that?
So you can't move your...
You can move it, yep, and then you go back down. How do you feel like this is doing it? It looks good to me. Yeah. So if you feel like this is easy for you, what you would do is add weight in your hand, or I can like advance core exercises, but normally I advance core exercises once the back is flat. And is it hard for you guys to do that? It should be, yeah, good. Okay, so that one is on your sheet, and it's called alternating leg arm touches. Do you guys want to take a pause and make any notes? Or you feel okay? Okay, we can go over it after. All right, so now since you're on your back, go ahead and put your hands under your hips, like this. Good. And flatten your back against the ground again. Straighten your legs out. You're gonna do big alligator scissor kicks like this. 1, 2, 3, with your legs. 4, 5, 6. The whole time, your back is flat, so keep them up the whole time. Like, and now switch here.
Oh.
There you go. Yep. You can touch the ground at the end of each one. Is it tough?
It is tough.
Yeah, so what I would do is like do one and then come down, and you can do the other one, come down until you get better. It's tough. So what I want you to really get in tune with is that your back is flat. Do not let that thing arch. That's my one rule where I'm gonna get kind of mean. So these are called scissor kicks. You can go anywhere from 20 repetitions to 50 repetitions. Please make sure that you are breathing during that, and that's why the one I showed you before is really important. You do not breathe with your ab muscles, okay? All right, now go ahead and bend your knees. We're gonna do heel touches. So stretch out your arms, and they're gonna be flat against your sides. And bring your feet back to you as close as your knees will let you bend. Good. Now, crunch up and touch your middle finger to the back of your heel. And then lay back down. Crunch up. You're really flexible.
Well,
So
that
we'll
way,
just-
not the other way.
We'll just come there. There you go. Yep, crunch. So crunch straight up and touch your middle finger to the back. Yep, good. So that one's an alternating one. Try to do it at the same time this time. Yeah, good. And some of us are not flexible, so you won't be able to get there. That's okay. Breathe out every time and then lay back down. Breathe out, lay back down. Good.
So you come up, breathe out, and then go down?
Yep, that is beautiful. So these are called heel touches. Get in tune with your back again, that it's flat. Little breath out every time you're crunching up, and then you're gonna suck air in when you lay down. It's kind of tough, right? Okay, so now we're gonna do heel touch alternating. So same exact position, you actually started it, but you're gonna swivel, touch the right one, come back, swivel, touch the left one. Yep, and what I want you to do now is relax your face so that it's flat into the ceiling. Stop using your neck.
That's the problem.
Yep. Now, that muscle that's across your neck, it's called the platysma, and it has to get a baseline strength to hold your head up, but it's gonna get to a point where it doesn't anymore. So what you do is you time yourself for like 30 seconds on these ones. Heel touch, alternating.
So what do you, that's kind of weird, what do you, if you don't want the fire, what are you using to hold?
Think about leading with your breastbone.
Okay.
And you're gonna get better. Your neck's gonna hurt the first few times. It totally will, but we don't want you to start depending on it. Don't ever curl your neck and lead with it.
He is not hearing you.
Okay. Yeah, do you feel that?
I feel it right back here.
Okay, how's that feel? Does it feel good? You feel your abs working? Okay.
The oblique area.
Yeah, obliques. Good, that's perfect. Okay, so now I'm going to have those of you that are comfortable go ahead and go onto your tummy. We're gonna lay flat over and maybe look at me. Everyone's losing money. Okay, so now we're gonna do what are called VWTs. These are really, really hard for your upper back. So you're gonna look straight down. You're gonna hold your arms up and you're gonna do a VWT. VWT. So what I want to turn on, yep, V, then come to a W.
Are you up almost like a...
Nope, it's very subtle. It's like, I'm just here. I'm gonna look straight at the ground. V, W, T. V, W, T. So these muscles are what should be working. Right here. Tough, right? So why are these so tough compared to everything else? This is because this is where I was saying right at the beginning. Good, bring your head down just a little bit. Because of our muscle imbalances, these upper back and neck muscles are so weak. You guys all feel those turning on?
Yes.
Okay. So, when you are ready to, you can advance that by putting these little weights in your hand. Don't do it too fast. I still use gravity with like mostly everybody, but you can put weights in your hand when you do them one day. Okay, so those are called VWTs. They're just on there. Now we're gonna do planks.
Yeah, planks.
So you're in the perfect position to plank right now. Be careful when you get up there, but we're gonna start with the straight arm plank. So I just want you guys to plank here. Let's try to hold it for like 30 seconds, and I'm gonna give you tips. While you're planking, what are we gonna focus on? Butt cheeks. So most people when they plank, they're here and they don't turn their butt on, and their hip flexors do the whole thing. And our hip flexors can plank us forever. So what I'm gonna do is drop my butt down and squeeze my cheeks together, squeeze my belly button in, and we're just gonna hold that position. Notice how my shoulders are right over my hands. Do not plank like this. It's bad for your shoulders. Okay, let's do it.
If you have weak wrists, can you do it on your forearms?
Yes, absolutely. You just probably will only be able to do like 20 seconds. All right, let's go. Bring that butt up. You got it. Okay, so if it's hard, we go to a surface. Go to your chair and plank off your chair. Like this. Now, breathe through that. Pinch your butt cheeks together. Suck your belly button to your spine. Good, that's perfect. So bring your butt up. Get like, I'm gonna grab you here. And now pinch together. Feel that? Yeah, so planks are fun. Let's stop now, good. For those of you who want to, you will advance down to elbows. So we have all these surfaces for planks. Honestly, like I think you'd be able to plank off a counter, like plank off your breakfast bar counter and just hold it, then stop. Hold it, stop. And the butt cheeks are what we're getting to fire. It's fun, okay? I personally feel that planking is probably the best thing you can do for your core. There's not much better. Now I'm gonna show you tap planks.
What is the difference between butt position when you drop lower versus higher?
So when you're here, that's a good question. Your spine is straight. When I'm here, my spine is hyperextended in the low back.
Okay.
You're gonna get kind of some pain there. So you just wanna be here, activation, butts on.
And then if you're higher,
If you're here, a lot of it goes into your shoulders, where this kind of makes your core contract because it's like being stretched out. Okay, so we're gonna do tap planks now. So I like tap planks because they're good for shoulder stability. So you're gonna go into the plank again. I'll probably have you do it off a chair for your wrists or a table. Dang timer. So you're here, alternate, and you're gonna tap up to the shoulder. Okay, let's do 30 seconds. Beginning in 3, 2, 1. Go up to a chair if you want to. Good, and back. That's beautiful. So shift your weight forward so your shoulders are right over your hands. Same here, shift forward, there you go. Yeah, and start to breathe. You guys feel that?
Oh, I feel it in my abs.
Yeah. Woo! Yeah, baby. And it's the same thing, maybe off a counter. You could do this one. Maybe. Almost there. 4 seconds. 3, 2, 1. Good job. Okay, good. I just wanted to show you what like a series of that feels like. So you go from 30 to 45 to 60 seconds. All right, let's sit in your chairs. Done on that. Whew, I need to have some water. Okay. All right, so let's grab your weights. Okay, so you have your little weights. We don't need much here. So what I passed out are 1s, 2s, 3s. If you want to switch something out, please do. 3s are actually a lot, which is kind of funny to think about, but they're a little heavy. So you're gonna sit on the edge of your chair like this, and you're gonna straighten your back out, stick your chest out, and lean over your lap. But when I lean over my lap, my spine doesn't sag, so I'm not So I want you guys. Take your weights, thumbs to the ceiling, do a raise like that. You're gonna look straight down at the ground. I want you to pinch your shoulder blades in and down. Good, lean over just a little more. Good. So we want you to be leaning over so that the weight is going through your back. We don't want the top of your shoulders working. Good, perfect. Yeah, they're up, thumbs up. And then lean over just a little more if you can. You guys feel that? That's really good form. So those are called reverse flies. These are honestly you can do them with no weight. I'm just showing you with weights because I think it's more fun. You can do these with your thumbs and just hold the position. Just like come here and hold, and then come back down. And you should feel these muscles in your upper back turning on. Am I right?
Oh yeah.
Okay, you're like, yes. So now you're gonna sit up, thumbs up. This one, you're up straight. Pinch your shoulder blades together behind your back, thumbs up, and then just back down. This is called a full can or a lateral shoulder raise. That's what's on your list. So the whole time I'm pinching the pencil between my shoulder blades. You guys feel that? Obviously these are pretty light. Some of you, yeah, you might not feel it. I can put mine in your hands too.
Yeah, no, it's good.
Yeah, so this is one of those things where it's not for physique. I'm not here to get you to just like totally toned. This is a functional movement. I'll meet 80-year-olds that cannot raise their shoulder past here. That's really scary. I don't want that to happen to you guys. So, lateral shoulder raises. Okay, then we have overhead press. So, for overhead press, you're gonna come into this position. You're gonna stick your chest out and squeeze your shoulder blades together. Literally press straight up and touch the weights over top of your head and come back down. So, if it's uncomfortable, it's only because your shoulders don't have the range of motion down yet. And make sure yep, that's perfect. You're pressing straight over your shoulder. Do not come forward. It feels kind of good, right? Feels nice. And see, you can do it without, do you want some weights? You can do it without weights. If you guys were to do these every single day, these shoulder range of motion, I can't tell you how great you'll be when you're like elderly. It's awesome. Any questions there? Okay, so that was overhead press. Okay, so now we're gonna do some Thera-Band stuff. I only have one Thera-Band, so we'll probably pass it around. And then while we're passing it around, I'll go over some other stuff with the waders. So, this is a Thera-Band. I'm sure you've seen these. You can buy these, they're relatively cheap. You can get them at a lot of physical therapy clinics for like, they'll cut you this for $5. You know, whatever. But the first one, you're gonna anchor your elbows into your side and go out like this. And my elbows never come off my side. That's called external rotation. So I'm gonna pass this around. I want you to all try that. And then the second one is here. Thumbs are facing each other, and I'm gonna come back like this, touch to my chest. Okay? So, give it to you. You can start 10 by 10. The others, as far as ab stuff goes, you can start to do stuff on your side. So if you're down on the ground, you can come into planks like this, where your bottom knee's bent. Take your little weight and do external rotation like this. This is a really good exercise. You wanna try? Might as well. Since we're waiting. So I'm having you bend the bottom leg just because of the strength thing. If you can plank straight legs, both, that's what you'll do. Yep, and then anchor the elbow and open it up and bridge your butt up more and hold that. So you should feel your oblique turn on. So bend your bottom knee. Good. Move that for you. And then plank up. It's gonna be really hard. Good, right there. Now bring this arm to your side like this. And externally rotate it.
Oh, like that.
Yep. And then so why I like this exercise? Because we have obliques working, butt working, and external rotation. It's good, right? Yeah. It's good. Okay, so that's another way you can do this. Obviously, I'm a huge person for shoulders. Shoulders are what I see damaged the most, so that's why I'm giving you so much shoulder stuff. Yep.
Here. And these are up.
Yep, thumbs are up.
Thumbs are up.
How'd they feel for you? Good? Yep, and then don't let your wrists turn. You're gonna keep your thumbs up the whole time. You should feel, think about your shoulder bone swiveling in the joint.
Okay.
Feel that? Yeah, external rotation. So good for you, so good.
And the other one is this way,
Yep,
all the way up.
just like that. I think they might have these at Shields too. Now I'm showing you 2 Thera-Band exercises because when I only have one, it takes a lot of time. There are like hundreds of Thera-Band exercises. You can do all those IYTs or VWTs I showed you, you can do with a band. You can do stuff for your legs. It's amazing. Yeah, just pass it around.
That's something you could do with the regular bands as well, right?
Yes, like the ones that kind of look like this. Yeah. Yep, they might be a little bit too tight, but like if they're the long ones, you might be able to get kind of close on one.
I have some longer ones that I can.
Yeah, totally, totally. So if you guys have any questions, yep, just hit me with them. And yes, almost like stick your chest out at the end, and don't let your elbows come off. It's hard. This D muscle right here, you should feel it. So if you guys hear people talking about the rotator cuff all the time, there's 2 muscles of the rotator cuff, teres minor and infraspinatus. They're your external rotators.
Then what's the second one after that one?
Thumbs together.
So maybe we can prevent, yep, just like this.
Thumbs, yeah.
Rotator cuff tears.
Keep your thumbs out.
Just like that. That one feels good.
You could do that with weights too.
You could do it with weights. We want the resistance to go this way. So with weights, your shoulders up here would be holding it. So if you want to do it with weights, you need to lay down.
Okay,
Do a reverse fly.
okay.
Just lay like prone. So the way that sheet is designed, like I said, you could go through everything. What I like to do is circuits. So I would prefer that everything we did today, you completed it 3 times, 2 to 3 times. When you get better at it, you'll be faster. It obviously took us a while today. But if we did a circuit training, I would take you through that whole thing, probably 2 to 3 times, and then you'd be done. If you are taking longer than you'd like, say it's longer than 20 to 30 minutes, split it right in half and alternate. Do this half this Monday, this half Tuesday, something like that. That's perfect. Feel that? So you're gonna stick your chest out right at the very end. Yeah, good. Did you kind of feel those?
Yes.
Okay, good.
Oh, yeah.
Okay, so anyone want to go over stuff? Have questions for me? I know it's a lot. I wanted to just be able to like clear up any fog, so.
Okay, so I used to work out with a trainer
Yes.
a couple years ago, and that was before I was diagnosed with my Hashimoto's, which is thyroid disease.
Yes.
And I followed his regimen to a T and gained weight. My hormones were off, and we're working on it. But what do you recommend in the interim? Like, just staying with low impact? Or,
For your exercise?
yes.
What did he have you doing?
Lunges,
heavy? Or was it circuit based?
circuit based.
Okay.
But it was, what he would have me do was do each one for 30 seconds, rest, 30 seconds, rest,
Okay.
30 seconds, rest, and then take a minute off.
Okay.
And just like walk the track for a minute and then start the next exercise.
And what were you eating?
Perfect.
Really well. Okay. All right. So I think what you should do is stay very like low intensity for a while. I don't think high intensity is your friend. This stuff is really good for you. You can advance it in all the ways I pointed out. And then if you're like, this is totally easy, we can give you things in the fitness center that you can do, or you can buy some equipment. But I would stay on the lower end of the spectrum for a while. Maybe do it twice.
I have a total gym and a Pilates
Yeah.
reformer that I'm gonna bring from my sister's house, so.
Yes. And I think you just work your way up to it, really get in tune with your body and see what you're feeling. I just wouldn't go too intense too fast.
Okay.
Yes. Any other questions? Roy, what do you think?
You know, I don't think the recording worked. Can we start all over?
It didn't work? That's so funny. Okay. That's funny. Next time. Yeah, so my big thing is just be confident in these movements. In the comfort of your own home, I think you guys are going to be more daring than you would be here or at a fitness center. So just do it. You know, try it out. Get a feel for it. If you absolutely forget what I said, YouTube is your best friend. A lot of this stuff is I've named it what it's really called, kind of in the fitness community. Look it up. They'll show you how to do it. Use things in your house. If you don't have weights, honestly, cans of soup weigh 2.5 pounds, and I can't tell you the amount of people who I programmed, like, okay, you're gonna use your can of soup in each hand for like lateral raises or something like that if you don't wanna go buy weights, which you don't have to go buy weights, you know? Yeah. I just want you guys to be comfortable. So, again, you'll repeat that 2 to 3 times. We're looking at a heart rate elevation for a period of time. So I want your heart rate to be up for at least 20 minutes, and then you can be done. 150 minutes a week.
Or eating before or after?
Eating before can be important if you're someone who has kind of low blood sugar. I don't think this will get you to the point where your blood sugar totally plummets, but if you do it and you haven't had anything to eat and you feel faint, dizzy, or nauseous, then you probably should eat before it. And it's within 45 minutes of working out before you start. Time of day is totally your call. Plan it around your life and make the time for it. Say, I'm going to do 20 minutes tomorrow at 5 a.m. when I get up, and that's the way it goes, and hold yourself accountable. Now, of course, I know that motivation is like my biggest villain, right? And so if you're struggling with motivation, reach out to Roy, reach out to me. We're not here to, watch you fail in any way. I want you to succeed. I want you to feel comfortable with this. So if you need my help, ask me for it. Okay?
You can leave your card.
Yes, I have cards. I just left them in my car. I set them on right next to my box, but I'll grab them. Okay?
Awesome.
Cool.